Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Medullary sponge disease. In medullary sponge disease, first and foremost, there is dilatation of distal portion of collecting duct is seen. There is dilatation of distal portion of collecting duct is seen along with numerous associated cysts. Because of this distal collecting duct dilatation and presence of many cysts, this will give the kidneys an appearance of the sponge. So it is called as medullary sponge disease. So here in the kidneys there is lots of cysts are seen in the kidneys, which gives rise to sponge like structure, and the collecting duct is the one which is mainly dilated in this section. Okay, this medullary sponge disease is an autosomal recessive disease, it is an autosomal recessive disease which is usually bilateral. This medullary sponge disease affects all the papillae. All the papillae, that is all the papillae in the kidney, are affected in medullary sponge disease. It may be unilateral also. It is usually bilateral, but it may be unilateral also. So in these cysts there will be stasis of urine will be seen in the tubules, and in the cyst there is stasis of urine is seen in the tubules, in the collecting tubules, and as a result this stasis of urine will it will invite the infection. So infection occurs, and because of the supersaturation of the materials in the urine, caliculi are also seen in the urine. So these mainly occur, this infection and stasis mainly occurs, sorry, infection and caliculi occurs due to the urinary stasis in the tubules. Then this medullary sponge disease. This medullary sponge disease is associated with hemihypertrophy of the body. It is associated with increased calcium, that is hypercalcemia. Now because of increased calcium, this calcium will be excreted in the urine, causing calciuria. There is hypercalciuria. Whenever there is increased calcium excreted in the urine, there is supersaturation of calcium occurs in the urine, resulting in this calcium will combine with oxalates and phosphate, resulting in calcium oxalate or calcium phosphate stone formation is seen. This calcium, because it is excess in amount, it even deposits into the renal parenchyma, resulting in nephrocalcinosis. So in medullary sponge disease, hemihypertrophy of the body, hypercalcemia, stone formation and nephrocalcinosis are seen.
thank you and thank you for watching.